I'm Dr. Shweta Bansal. I'm a pediatric hemato-oncologist and bone marrow transplant physician. Today, on this occasion of Cancer Prevention Month, we will talk about children, how to prevent our children from having cancer and how to recognize early signs and symptoms. किसी भी बच्चे के अंदर जब भी कैंसर होता है तो हम कभी भी नहीं सोचते कि बच्चे को कैंसर हो सकता है, पर कुछ साइंस एंड सिम्टम्स और कुछ लक्षण ऐसे होते हैं जो बच्चे के अंदर बताते हैं कि कैंसर होने की संभावना है, और अगर उसको सही टाइम पे चेक किया गया तो कैंसर होने के या फिर कैंसर को बचाने की संभावना बढ़ जाती है. So there are few signs and symptoms which we should take care of. There are certain red flag signs. These signs are, one is the child is having continuous fever and it is not getting controlled by antibiotics, and the child is already having some low count, some bleeding. All these signs and symptoms are there. So if you are treating your child with continuous antibiotics and he is not responding, it is always better to take a second opinion from some pediatric oncologist to rule out any cancer in these children. Second is any lymph node swelling. कोई भी गिल्टी कहीं पर भी बॉडी में कहीं पर आती है, जैसे गर्दन के पास कोई गिल्टी है, बगल में कोई गिल्टी है, जांघ के पास कोई गिल्टी है, वो धीरे धीरे बढ़ रही है, उसमें कोई पेन नहीं हो रही है, इट इज़ कम्प्लीटली अ पेनलेस स्वेलिंग and it is increasing in size, then it is very important to check that lymph node swelling and get it biopsy done so that any cancer can be ruled out at an early stage. Another important sign and symptoms we see in children which gets ignored, if the child starts drinking lot of water, which is known as polyuria, starts passing urine more in the night, which is known as polydipsia. So any child, if you see a change in their drinking habits, that they are drinking almost 3 to 4 liters of water, passing urine or wetting the bed in the night, then again that should be checked. We have seen many cases like that and diagnosed a cancer which is known as Langerhans cells histiocytosis in these children. Another important sign in these children, especially we see in brain tumor patients, is abnormal vomiting. Most of these children, they vomit early in the morning. सुबह जब स्कूल जाते हैं तब उनको वॉमिटिंग होती है. Most of the parents, they ignore this sign and symptom, thinking child doesn't want to go to the school, that's why he is vomiting. But if the child is having continuous vomiting, his headache is getting relieved post vomiting, then definitely you need to see a doctor, because child may not be complaining just unnecessarily. There may be something else over there, and we need to do a proper examination and investigation of the child. Another sign and symptoms which we see in a child which raises an alarm is child is not taking interest in the surroundings. He is becoming lazy, he is not feeling going out, and he doesn't want to play with the friends. He starts losing weight. So all these things always need to be taken care of, and proper investigation is very, very important. So these few signs and symptoms, though looks like very common things which we find in children, but if they get prolonged or they remain persistent, मतलब लगातार रहते हैं, तो definitely इन सबका जांच करना बहुत ज़रूरी है.